First cribriform plate, that is cranial nerve 1. It is in the olfactory groove. All this are anterior cranial fossa, and it is through the ethmoid bone. Okay, so that is the first. Okay, that is the cranial nerve first. There is no relay to the thalamus in case of cranial nerve first. Okay, no relay to the thalamus. Second, so this is cribriform plate. All right. Here you have the crista galli. Very important. Okay. Next, the second cranial nerve is obviously optic nerve. It goes to the optic canal, and it will go to the optic canal. Okay, it is important in case of optic nerve goes directly into the eye, and that is fine. Where did we have the optic nerve? Is a derivative of the diencephalon from the optic stalk along with the retina, and uh, tongue tongue is third, fourth, posterior, most posterior, and anterior is the first branchial arch. Okay, so this foramen, optic foramen, you basically have optic nerve and ophthalmic artery. Optic nerve, ophthalmic artery. Then the second is going to be the superior orbital fissure. So superior orbital fissure, you're going to have the third nerve. Okay, third, fourth nerve, and the V1, V2, third, fourth, V1, V2 of the fifth nerve also. Okay, next is V1 of the fifth nerve. Next we have is foramen with, what did we have? ROS, ROS. Okay, I think that was it. That was the mnemonic. So R was rotundum. Rotundum was maxi पहन के rotate. So maxillary artery, I think here. Okay, yeah, we had ROS here, and this is the superior vital fissure, so it was ROS. Okay, maxillary nerve artery, which one is, okay, so maxillary was ROS. Okay, rotundum. Ovale is male. Okay, so what was it? M for middle middle meningeal. Okay, middle meningeal artery. Then there was male structures. One was middle meningeal artery, axillary meningeal artery, axillary meningeal artery, not middle meningeal, axillary meningeal artery, and we had mandibular nerve. Okay, ovale was mandibular nerve. M for male. Okay, ovale male, mandibular nerve, axillary meningeal artery, and lateral pectoral nerve, I think it was, and emissary veins. And S was spinosum. Spinosum was what? Spinosum. Okay, so we'll have to see that. Okay, so spinosum. Spinosum was this we'll have to see. EDH. I think middle meningeal artery only it was. Let's see. Now let's quickly see this. So cranial nerve 2, it goes with the dura sheath, that is important, and this dura sheath, it does have sensation because it covers the cranial nerve, right? So you have cranial nerve 1, no relay. This is going to be cranial nerve 2, ophthalmic artery. Your orbital, this thing is going to be 3, 4, and 3, 4, and 6. Yeah, 5 is outside. 3, 4, and 6 abducens. Okay, 3, 4, and 6 also. 3, 4, and 6 is present in the cavernous sinus as well, along with V1 and V2. Okay, 6 is near the carotid artery of the cavernous sinus, and these 3 are on the lateral wall. Okay, V1. So okay, yeah, V1 is the ophthalmic nerve. So that is see. First, we have the, now come back to this, come back to a larger version. So middle cranial fossa mein, obviously you had the optic canal in the lesser wing, and here between lesser and greater wing we have the superior orbital fissure, and in this we had these 3, that is 3, 4, and 6, 3, 4, and 6, and 3, 4, and 6 now. Okay, that is all going into the superior orbital fissure. V1 is also going with this only. Okay, see, this is the fat trigeminal nerve dividing into 3 parts, 1, 2, and 3. Wait, it takes a bit of time to adjust. So you have this fat trigeminal nerve here. Okay, it's really thick trigeminal nerve dividing into 1, 2, and 3. So this is going to be the first branch, that is V1. Ophthalmic is going to the superior orbital fissure. Okay, V2 maxillary Ross. Okay, maxillary nerve. So that is going into the rotundum, maxi पहन के rotate, and this is in the male structures which had come basically in the exam. So ovale male. Okay, mandibular nerve, axillary meningeal artery, lesser petrosal nerve, I think that's what it was, we have to say that, and emissary veins is there only. Okay, so V1, V2, V2 maxillary nerve, this is done. Okay, and V3 middle meningeal artery. Okay, this spinosum is middle meningeal artery. Yeah, spinosum is middle meningeal artery. Okay, male ovale. Okay, and spinosum also. This is another mnemonic. Spine is in the middle of the body. Okay, so that's why spinosum, and you have middle meningeal artery. Okay, and middle meningeal artery is a branch of which part? First part of maxillary artery. That also has come in some exam. Okay, um, another this thing is pterion. Okay, so spine, that is this thing, the spine, middle meningeal artery, this middle meningeal artery, this part is also related to the pterion. Okay, so this part is also related to the pterion. Okay, so pterion, that's why you have the middle meningeal artery at that particular point. Let's see here what were the structures. So mandibular division of the trigeminal nerve. Okay, axillary meningeal branch of the maxillary artery. Okay, axillary meningeal branch of the maxillary artery. Okay, so that's what it is. Rotundum has maxillary nerve. Okay, that is V2, while accessory meningeal branch of the maxillary artery is for ovale ka A. Okay, axillary meningeal branch of the maxillary artery, and finally you have the emissary veins. Okay, and L is the lesser petrosal nerve. Okay, so this was fine. lesser petrosal nerve only. एकदम श्योर हो गया. फिर से M mandibular branch of the trigeminal nerve, that is V3. A axillary meningeal branch. Okay, axillary meningeal artery या axillary branch of axillary meningeal branch of the maxillary artery. L is lesser petrosal nerve and E is emissary veins. So this is done. Okay, R is also fine. This is also okay. So we go back this side and see this. So V1 ophthalmic nerve, R your this thing rotundum में maxillary nerve, and V3 we said that. Okay, along with the male structures. Spinosum is middle meningeal artery. Pterion, remember EDH. Okay, middle meningeal artery. This is epidural hemorrhage. Epidural hematoma में middle meningeal artery. Epidural middle meningeal artery. Okay, and subdural to bridging veins, I think. So epidural is middle meningeal artery, very close to the bone, between the two dura layers. Okay, so middle meningeal artery, pterion. Okay, remember this. Branch of the first part of the maxillary artery. Middle meningeal artery is the branch of the first part of the maxillary artery. Here, whatever arteries that is there, it's all branch of the maxillary artery. Okay, that V3, with V3 we had the male structures, so it was mandibular nerve, and A was axillary meningeal branch of the maxillary artery. Okay, and here also middle meningeal artery is a branch of the first part of the maxillary artery, and it supplies the brain, meninges, and the ear. And basically this first part is supplies the brain, meninges, and the ear. Next, maxillary nerve in the pterygo. So maxillary nerve we have this. Okay, next another this thing. Okay, just a small note on juvenile angiofibroma. So juvenile angiofibroma, we have Redkowski staging. Okay, Redkowski scoring. Origin in the sphenomandibular foramen. Okay, sphenomandibular foramen, pterygopalatine fossa. Then it goes intracranial spread, and through that through V2. Okay, so maxillary nerve through this foramen rotundum only juvenile angiofibroma is spreading. So juvenile angiofibroma again Redkowski scoring. Juvenile angiofibroma में we have Redkowski scoring. It originates in the sphenomandibular foramen. Okay, sphenomandibular foramen it will originate in. Then it will go to the pterygopalatine fossa, and from the pterygopalatine fossa it is going to have an intracranial spread. Basically, from the pterygopalatine fossa, sphenomandibular foramen. This is downwards, pterygopalatine fossa little upwards, and then from there intracranial spread through what? Through this, through V2. okay, through V2, that is foramen rotundum. Okay, here we know below this is the sphenoid greater wing. Below this, these all are foramens in the greater wing. Okay, and this just underneath this is a pterygoid plate. Okay, so from the pterygoid plate, between the pterygoid plate, there you have the pterygopalatine fossa. Between the pterygoid plates and the palate, we have the pterygopalatine fossa, and then from there you have this V2 spread, that is through the maxillary nerve, through the foramen rotundum, juvenile angiofibroma spreads. Okay, next we have, let's go posterior. So anterior ka is done. Let's try and do posterior. I'm very bad. No, I'll not say anything. Okay, let's try. Okay, let's try doing active recall. So let's see, this is your jugular foramen. Okay, so this is jugular foramen. When you see the jugular vein going, right, so this should be the jugular foramen, and this should be the 12th, I guess, hypoglossal canal. Okay, that is 12th nerve. Again, correlate the brain stem. 12th nerve comes from between the olive and the pyramids. Okay, from between the olives and the pyramids we have the 12th nerve, and this is obviously foramen magnum, everyone knows. And this is your, see, this is the temporal bone. So this is internal auditory meatus. We have the vestibulocochlear nerve going. Okay, so vestibulocochlear nerve and the 7th nerve also. Okay, and here obviously 7th nerve, and this is the 12th nerve. So 7th, 8th is done. So 9, 10, 11. Okay, so this is probably 9, 10, 11. Okay, and this is very obvious also, because you know, if you think the brainstem was like this, right, this way and this way. Okay, so through this middle one, your anteriorly, a bit more anteriorly, your hypoglossal nerve was coming out, that was between the olive and the pyramids, and posterolateral sulcus say these three nerves were coming out. Okay, you had first, you had the 9th nerve, then the 10th nerve, and then the 11th nerve. Okay, so 9th nerve, 10th nerve, 11th nerve, that was the posterolateral sulcus. So that goes with jugular foramen. So let's see what happened. Okay, so yeah, this is fine. This is the 7th nerve, this is the 8th nerve. So this is this thin one. This thin one is the 7th nerve. Okay, and this is the 8th nerve. Again, try to recall. At the level of the pons, we had trigeminal nerve coming out. So all this was trigeminal front. Next, we go a little more down in the pontomedullary junction, and we have these two. Okay, so 7th and 8th. Okay, so 7th यहाँ पे and 8th here. Okay, so 7th and 8th. Okay, so 7th and 8th nerve is done. 8th nerve is a fat one, because obviously vestibulocochlear nerve, and this is the internal this thing. And 9, 10, 11, 9, 10, 11, exactly in the order. Okay, so 9, 10, 11, and 9 separates. Yeah, so glossopharyngeal nerve, this is important. Okay, it basically has a separate canal. Okay, so this had come in one of the, I mean it had come in INICET only, that glossopharyngeal has a completely separate canal than these three structures in that jugular. Okay, jugular foramen. So 10 and 11. 11 is the descending branch. Yeah, axillary, we have spinal accessory, so this is the descending part of the spinal accessory. Obviously it is going out and then again it comes up. Okay, and jugular, obviously internal jugular vein. So we have this. So 9, this is 9, and this is 10, and this is 11. Okay, 9, wait, this is 9, this is 10, and this is 11. Done. Okay, next, so posterolateral sulcus. Next, obviously here we have the 12th nerve going. See this is the 12th nerve. Okay, so 12th nerve, and then we have the brainstem, spinal root of the cranial nerve 11. Okay, basically this here they are saying, right, wait, okay, what did that mean? This is weird. Spinal root of the cranial nerve 12, and they have marked the same structure as descending branch of that. Okay, acha. Anyways, whatever. It's all there only. They have just accumulated it. And obviously, front में we have the fourth part of the vertebral artery. Fourth part of the vertebral artery. And second part of the vertebral artery was where? That was in the axis, atlas, yeah, axis. Okay, that is also important. That second part, vertebral arteries relations with what? With that, with the axis. Okay, not atlas, axis. Okay, so we have to see that vertebral artery ka relations with the axis and atlas. Okay, so anyways, that is one of the questions actually of past years. Okay, so second part of the vertebral artery is related, okay, to the axis or atlas. Okay, so that we have to see. Second part of the vertebral artery is related. Okay, foramen say you have the first part, then you have the second part, and here we have the fourth part. Okay, so fourth part is here, vertebral artery, fourth part. Okay, so brainstem, obviously lower end of the medulla meninges, and posterior neuroscleral structure, all this is not required. Anterior and posterior foramen magnum. Okay, and this is the internal auditory meatus ka. This is the Bill's bar. Okay, so internal auditory meatus. This is going to be the Bill's bar, and this 7 up coke down. Okay, 7 up coke down, and falciform ligament. I mean, not falciform ligament. That's falciform. This thing. Oh, and falciform crest, and this is Bill's bar. Falciform crest. 7 up coke down. The cranial nerve 7, superior up is superior vestibular nerve, and cochlear is inferior vestibular nerve. Okay, so cranial nerve 7, okay, superior vestibular nerve, inferior vestibular nerve, and cochlear nerve. So basically, vestibular cochlear nerve divides into 3 parts in the internal auditory meatus. Okay, so all this that we did. Okay, key, we had the jugular foramen, okay, and hypoglossal canal, and the internal auditory meatus and the temporal bone, and this, okay, and foramen magnum. Hypoglossal canal is closest, the basically structure closest to, how will you identify structure closest to the foramen? Magnum is hypoglossal canal, and the junction between the temporal and occipital bone, we are going to have the jugular foramen. Okay, junction between the two bones is going to be jugular foramen. So this is done. Okay. Okay, so I guess more or less that was okay. And foramen lacerum, greater petrosal nerve passes from foramen lacerum, as far as I remember. Another one is this Dorello's canal. It is Dorello's canal. Abducent nerve goes to the Dorello's canal. It is in the petrous apex. Okay, so abducent nerve, it is in the petrous apex somewhere here. Okay, and you can also have Gradinevos syndrome. Okay, petroclinoid ligament. Gradinevos syndrome consists of ear discharge, important for ENT, ear discharge, abducent nerve palsy, and retroorbital pain. Abducent nerve palsy, that means LR6 ear discharge, and finally retroorbital pain. Gradinigo, retroorbital. Okay, G looks like E. Okay, so ear pain, and obviously ego, ear, kind of. So ear discharge. I don't know what else, what other mnemonic to come for this. Okay, so this is more or less fine. Next is we have the arteries. Artery, okay, little bit only, just this whole, because we had discussed it before. So okay, obviously medulla mein, okay, we have the, like, just the relation of the arteries to the nerves little bit. This is important because of the Berry's aneurysm. Okay, so first we have the anterior spinal artery, which is joining to form the basilar artery in front of the pons anterior spinal artery. Obviously medial medullary syndrome, this is coming from down, and lateral medullary syndrome, we have the posterior inferior because it was going like that. Okay, let's do this one. Next is the relations. Okay, so if you see the relations, obviously we had this here 12th nerve, okay, 11th nerve, okay, और 9, 10, 11 was पीछे से was back. Okay, next is between these two, between the pica and the vertebral. Okay, so just below the pica we have, what do we have? What is this? This is your sixth nerve. Okay, pontomedullary junction. See, this joins at the pontomedullary junction to form the basilar vein, and the moment the basilar vein forms, we have the posterior inferior cerebellar artery. That's going to be the pica. So that's why from the middle, what do we have coming is the seventh nerve. That is the seventh nerve. Seventh nerve is going to be pons. Not of much significance. Next is anterior inferior cerebellar artery. So cranial nerve third is important, okay, because it lies between the posterior cerebral artery and the anterior inferior cerebellar artery, okay, and there are that interpeduncular fossa. So this is important, okay. So which are the nerves that lies in the interpeduncular fossa? Interpeduncular fossa is basically, see, from here in the pons you basically have interpeduncular fossa which connects the brain stem. Okay, you have the midbrain has you have the two here you have the peduncle which basically connects the whole brain stem to the cerebrum. Okay, so there's the interpeduncular fossa. So in case of interpeduncular fossa you have these three nerves. Okay, your third, fourth and fifth. Okay, so third, fourth, basically mainly third. Okay, so third, what happens in the interpeduncular fossa? Here these two, the what happens is the basilar artery divides into posterior cerebral artery, okay, to form the circle of Willis-ka, this thing. Okay, so posterior cerebral artery, it is dividing into, all right, and so you have, okay, so first this is the posterior cerebral artery that is dividing into, and then there is the posterior communicating artery also here, and also you have the ICA, that is anterior inferior cerebellar artery, that is coming from the basilar artery. So between pica and PCA, what do you have? You have the third nerve, that is in the interpendicular. So third nerve is between the pica and the PCA. Okay, this is the ICA and the PCA. This is the ICA, anterior inferior cerebellar artery, and then you have the PCA. Okay, so that is important. Then you have the posterior communicating artery. After that, you have the internal carotid artery giving the middle cerebral artery. Basically, this connects. Okay, so we have the internal carotid artery, which basically gives, this is the anterior cerebral and this is the middle cerebral. Okay, if I'm not mistaken, this side is the middle, anterior, middle. Okay, so here, wait, just let me clarify because sometimes even I get mixed up. Yeah, okay, internal cataract is going like this, it is giving rise to middle cerebral. Okay, and middle cerebral which is going into the uncus, and then you have the anterior cerebral, and anterior cerebral is being connected by the anterior communicating artery, and here this whole set means the anterior and the posterior is being communicated by the posterior cerebral communicating artery. So yeah, posterior communicating artery, it is very close. Okay, it is very close here, it is very close to the third nerve, so its aneurysm causes third nerve compression. Okay, so its aneurysm causes posterior communicating artery, the third nerve, it is very close to the third nerve because PCA and superior cerebral, PCA and it lies between here. Third nerve lies between the PCA and the superior cerebellar artery, and here you have above it, you have the posterior communicating artery. So if any kind of aneurysm happens, it will directly go and compress the third nerve. So you'll get the third nerve symptoms in case of aneurysm of the posterior communicating artery. This is from this thing, sir, Ashwini sirs. Okay, so let's quickly revise this. So jugular foramen, basically jugular foramen we had like this. Okay, so jugular foramen we had ninth, 10th, 11th. Ninth is a separate canal in itself. Okay, and also we have the inferior petrosal nerve. inferior petrosal sinus and the sigmoid sinus. This is also important. Sigmoid sinus, okay, we have the jugular vein, okay, the jugular vein. We also have that inferior petrosal sinus and sigmoid sinus in this, and meningeal branch of the ascending pharyngeal and occipital artery. Fine, okay, and structures of this sphenoid bone. Okay, obviously we know that these are the pterygoid plate, foramen rotundum bahar se rotundum jugular, this thing. Okay, so that's why this is so well visible, and Ross O and S is not visible. That's why that jugular angiofibroma, okay, juvenile angiofibroma can easily pass from here. Okay, V2. All right, so medially this particular thing is going to be rotundum, okay, rotundum maxillary nerve. All right, and then we have, this is the Vidian canal. Okay, between these two legs is the Vidian canal. Okay, and then we have the pterygoid canal below. So pterygoid canal, it goes like this. Pterygoid canal, from the this is the pterygopalatine foramen. From the pterygopalatine foramen, it is going to go like this. Okay, first we have the sphenopalatine foramen, pterygopalatine foramen, then after that from foramen rotundum, then this. Okay, next is lacerum. Lacerum is important. So lacerum. Okay, lacerum, we are going to have foramen lacerum is obviously medial to ovale. How will you identify it? Medial to ovale. Okay, so little bit of here we can do the identification. Okay, so if we had this, okay, so obviously here we have, this is the hypoglossal canal, and here we have, this is the closest foramen to the foramen magnum is the hypoglossal canal. Lateral to it, this is the jugular foramen. Okay, and the this thing, you have the sphenoid, and you have the occipital, and you have the this thing, you have the sphenoid, occipital, and we have the temporal. All these bones together, they make the foramen lacerum. And see, this is the sphenoid greater wing, right? So greater wing of sphenoid, this is ROS. Okay, ROS. All right, going like this. S is smallest spinosum, obviously closest to spinosum. If we can identify spinosum, closest to spinosum is going to be what? This is going to be O, and this is going to be R. Okay, that is rotundum. So rotundum, ovale, and spinosum, and then here just close to it, okay, just opposite to this is the carotid canal. Okay, so just opposite to this male structure. Okay, male structure ovale. Okay, medial to is the carotid canal, and anterior, right medial, like basically like close to this. Okay, near the petrous apex we'll have the foramen lacerum. Just remember petrous apex, and this medial to the ovale. Okay, like very close to the ovale and the rotundum, the structure that you have is the foramen lacerum. Okay, that's how you can identify, because it's very quite easy to identify the three foramen on the this thing, on the sphenoid, greater wing or sphenoid. Next we have this. Okay, so sphenoidal petrosphenoidal fissure. Now in case of foramen lacerum, okay, there are the traversing structures. So traversing structures is meningeal branch of the ascending pharyngeal artery, and then we have the emissary veins. Okay, and what are the structures that is there? The three bones, obviously we saw: sphenoid bone, apex of the petrous bone, and basilar part of the occipital bone. That was very obvious. Next, last but not the least, we had ICA sympathetic plexus. What fills up the foramen lacerum? Okay, internal carotid artery. Okay, internal, just think that carotid canal is very close by, so internal carotid artery, sympathetic plexus. Okay, and deep petrosal nerve and greater petrosal nerve. Greater petrosal nerve I've spoken about, but these three I've forgotten. So ICS, sympathetic plexus, and DPN. That is deep petrosal nerve, greater petrosal nerve. Lesser petrosal nerve was from where? That was in the male structures. That was with V3. Mandibular nerve, ovale, foramen ovale was lesser petrosal nerve, and deep petrosal nerve and greater petrosal nerve is going to be this. Okay, foramen lacerum. Okay, So I guess that is done. Okay, foramen lacerum and the 3 and how the jugular foramen basically we have. Okay, now this, okay, this was a mnemonic that I had basically constructed kind of. Okay, so one to is LFT Sonia, okay. So anyways, that is not this thing. Okay, so first is LFT. All right, so how we have superior orbital fissure, what all passes. Okay, so LFT passes. All right, so we had seen that through the superior, through the this thing, through the superior orbital fissure there were many nerves that was going, like you had the third nerve going and the fourth nerve was also going, sixth nerve was also going, everyone is going. So now they'll start dividing. Okay, even V1 V2 was going, all these structures are present in the cavernous sinus also. So LFT, when LFT, how does the mnemonic work here? LFT. Okay, so okay, so now we have this ring and we have LFT. Okay, so we'll just maximize this. Okay, and then we'll try to answer first. Okay, so first is this is LFT. Okay, so lacrimal frontal nasal, and V1 lacrimal is V1 का branch, lacrimal frontal nasal, all three is ophthalmic nerve का branch V1. Okay, and this one is which vein I forgot. I think ophthalmic vein, superior division. Okay, and this is the recurrent branch of the middle meningeal artery. Okay, then we have one this thing also, the recurrent branch of the middle meningeal artery. All right, so this is basically the lesser wing. Okay, so I mean this is the greater wing. Okay, so this is part of the greater wing. Fine. Next is okay, so I think more or less that was fine. So superior orbital fissure, we had all those nerves going. LFT is V1 का branches, lacrimal, frontal, LFT. Okay, wait, was it LFT? Yeah, lacrimal, frontal, and trochlear. Sorry, lacrimal, frontal, trochlear. Okay, trochlear is from out of the superolateral part, out of the ring. Okay, and recurrent branch of the middle meningeal artery. Now again, let's see. So uh, okay, okay, LFT is out. So L, okay, lacrimal branch, F, frontal branch, T, trochlear branch. So lacrimal branch is V1, frontal branch is V1, and trochlear nerve is 4, the fourth nerve. Okay, lacrimal frontal is from this thing. Lacrimal frontal is from what? Ophthalmic nerve. Okay, and here we have the recurrent branch of the middle meningeal artery. Okay, this is the recurrent branch of the middle meningeal artery. Alright, so that is done, and this is the greater wing of sphenoid. Now we'll go into what? This is the zonula of Zinn. Okay, here most important is this thing. Okay, here obviously these this thing is important. I think this was levator palpebrae superioris. This was what? It's superior, so I'll take it as superior orbital nerve. This is superior rectus. This is what? This is maybe medial rectus, lateral rectus, and this thing. We have to see that. Okay, so this is also important. Next is optic canal, obviously. So optic nerve, ophthalmic artery. Okay, next we have these nerves. Onoa. Okay, Onoa. That is the basically the this thing, the mnemonic. Okay, Onoa. So this was given by Rajaratna ma'am. Okay, so N is nasociliary, O is what? Okay, O is superior division of the oculomotor nerve, and this is I think the inferior division of the oculomotor nerve, and A is abducens nerve here, and this was the superior vein and superior ophthalmic vein, and this is the inferior ophthalmic vein. Okay, so let's check. Okay, so inferior ophthalmic vein, fine. Okay, and that was superior ophthalmic vein. So basically the veins are out of the zonula of Zinn. Okay, and zonula of Zinn. All right, and this is Onoa that we did. Okay, so superior branch of the oculomotor nerve, this one, nasociliary, inferior branch of the oculomotor nerve, and abducent nerve, that is the third. So nasociliary, obviously that is the ophthalmic nerve ka branch, and common tendinous ring to that we had. Okay, fine. Okay, and Actually, here there can be another mnemonic. There was a cartoon, okay, called Oban Star Racers. Okay, this is one of my favorite cartoons, by the way. Okay, so whatever. So Oban Star Racers is a long time back. Okay, it's about a female pilot. So Oban Star Racers, Oban. Okay, so when we say Oban, that is oculomotor both. Okay, both branches. That is superior and inferior, and A is abducens and N becomes nasociliary. So Oban star racers, because stars they are very superior, so superior brighter fissure, they look like a star. So basically that. Okay. So those were the intermediate ka contents. These were the superolateral ka contents. These were the intermediate ka contents, and these were that one branch is the inferior most content. Okay. So that basically, yeah, this was another mnemonic. Liver is present in the superolateral position. Okay, so liver, since it's present in the superolateral position, we do liver function test for liver, and in the eye, in the superolateral position also we have an LFT, that is lacrimal frontal trochlea. Okay, so that is basically the mnemonic. Okay, this is yeah, here we just had that one question in NEET. Uvula ka sensory supply comes from glossopharyngeal nerve. Okay, although we can just go through it, not very this thing. Without relay, Edinger Festfall nucleus, sphincter pupillae. Okay, pretectal nucleus, Edinger Westphal nucleus, muscarinic receptors, accommodation, levator palpebris superioris, mastication is trigeminal. Anterior to third tensor tympani, dampening of the sound. Dampening of loud sound, tensor tympani. That can be a significant one. Okay, dampening of loud sound, tensor tympani. Facial nerve, obviously, your salivation, lacrimation, facial nucleus. Salivation, like eye closing, vestibular cochlear hearing balance. Okay, glossopharyngeal is important. Glossopharyngeal ambiguous nuclei. So motor supply. Okay, taste and sensation, swallowing, nucleus ambiguous. Okay, parotid gland, salivation, monitoring of the carotid and the carotid body and the sinus chemoreceptors. This is also important. Carotid body, and there was another body. So that was vagus ka body. So carotid body is glossopharyngeal nerve. Okay, sinus chemoreceptors, baroreceptors, elevation of the pharynx and the larynx. That's going to be stylopharyngeus. Okay, vagus, vagus. So uvula sensory supply, glossopharyngeal. Taste from the uh, supraglottic region. Okay, that is 10th absolute posterior. That's what we had in the tongue. Okay, fourth branchial eminence. Okay, swallowing. Okay, swallowing, soft palate elevation, midline uvula, talking. Okay, so these are all taste sensations, swallowing, soft palate elevation, midline uvula, this thing, monitoring of the aortic artery. Okay, yeah, aortic arch ka chemoreceptor was this, and carotid body ka chemoreceptor was glossopharyngeal. Axillary shoulder shrugging, trapezius tongue movement is hypoglossal, except which muscle? Except which muscle? Except palatoglossus. Okay, palatoglossus supplied by the 10th nerve. Okay, and see soft palate elevation, palatoglossus, whatever. Okay, next is cranial nerve reflexes. Okay, so this one. Okay, corneal. See, try to read corneal. First, the sensation. So obviously, sensation will be carried by trigeminal nerve, and then after it we shut our eyes. So orbicularis oculi is going to be the 7th. So okay, nasociliary. Okay, nasociliary was a part of Onoa. Okay, Onoa is what? O ophthalmic nerve, abducens nerve. This is thing. Okay, it is from the ring, common tendinous ring. Cuff. What we do? First is the 10th nerve. Okay, that will carry the sensation, and then after the 10th nerve will only do the cuffing. So phrenic and spinal nerve. Gag reflex. Gag reflex had come in NEET, I think. Neat. I think no, it is blue. Okay, so afferent for gag. Gag. When do we have gag reflex? That is when like we touch the posterior wall. Okay, so here obviously the pharynx. Okay, posterior 1/3 of the tongue we have an elevation of the pharynx and the larynx. So taste sensation. So here basically Ninth nerve is the afferent, and 10th nerve is the efferent. Everything 10th nerve is the efferent because this is the motor branches. So gag reflex ninth nerve is the afferent, while cuff reflex 10th nerve is the afferent. Jaw jerk is mandibular nerve, okay, and it is supplied by mandibular only, I think. Yeah, okay. So jaw jerk is sensory, okay. It is jaw jerk is going to be sensory from the muscle spindle of the masseter V3, and V3 is only going to be the motor. So these two, whatever is the sensory, whatever is the motor. I mean, this is a good enough this thing. See, this is the same, okay. These two are the same. This is also the same. These two are the same, okay. And next is, okay, another one is orbicularis oculica temporal branch. This also we can remember. Next is lacrimal. So lacrimal again, we had the lacrimal nerve, okay. LFT, lacrimal frontal trochlea, out of the zonula of Zinn, okay. So V1, okay, that is V1, does not preclude emotional tears, okay. Loss of reflex V1, okay. And seventh nerve, obviously lacrimation, lacrimal nucleus, lacrimation is from seventh, okay. Next is pupillary. Pupilla is 2 3. 2 is basically shine the light, optic nerve will this thing, and 3 will obviously do all the, sphincter pupillae. It is the parasympathetic supply. So yeah, that has to be there. 3 is going to be this thing. So let's revise it once more. Okay, so corneal was what? Corneal was V1 and 7th. Cuff reflex both was 10th. Okay, 10th, phrenic and spinal. Gag was glossopharyngeal afferent, and that side 10th nerve is going to be the efferent. Jaw jerk, both is same. Okay, that is masseter, muscle spindle of the masseter. Lacrimation, first is going to be the lacrimal, that is coming from the V1. Okay, V1 is the afferent. Okay, I don't know whether it's lacrimal, V1 is the afferent, and facial nerve is going to be the efferent. Okay, and pupillary reflexes 2 and 3 because we shine the light, and then after the parasympathetic stuff will act via the third nerve. So yeah, that is done. Next is this. Okay, so this is very important. These images I had taken from Ashwini Sauka, this thing. Okay, so temporalis, this entire muscle is the temporalis. It helps in elevation, retraction. Okay, nice directions also. Next, so temporalis, nice direction. Next is masseter. Masseter is this way. Okay, so masseter, obviously jaw jerk. Okay, elevation. Okay, jaw jerk. Masseter is also elevation. Everything is elevation. Medial pterygoid, see, medial pterygoid is this. Okay, and this is the lateral pterygoid. So medial pterygoid is elevation, okay, and lateral is protraction. Okay, so there, temporal and masseter. Temporalis, masseter, big muscle on outside. Okay, this is inside, and here we have lateral pterygoid. Okay, so lateral pterygoid at the TM joint insertion. Okay, protrusion. Okay, depression. So basically everyone was elevation, only this is depression. Okay, so depression and protraction. Okay, so depression and protraction, and because it causes, and there is, because it causes depression, that's why it helps in protrusion of the temporomandibular joint. Okay, insertion on temporomandibular joint, lockjaw, it will cause problems. So this is a previous year question. Okay, that lateral pterygoid is the only one that does protraction and depression. Okay, so now we have lots of good stuff. Okay, so mastication muscles, obviously, which one closes the jaw? Everyone closes the jaw except the lateral pterygoid, which basically protrudes the jaw and opens the jaw. Okay, so three muscles close the jaw: masseter, temporalis, and medial pterygoid, because they all do help in elevation. Okay, so retraction is one of the additional functions of temporalis. obviously retraction, and protraction. Okay, protraction was lateral pterygoid, temporalis was retraction. Okay, and all is innervated by trigeminal nerve, mandibular nerve. Mandibular nerve V3. V3 was, what are the structures V3 passes through? Major structures. So male foramen okay, that is male. Again recollect. Mandibular nerve, axillary branch of the maxillary artery. Okay, axillary meningeal branch of the maxillary artery. L is lesser petrosal nerve, and E is what? E is emissary veins. Okay, so here I have a mnemonic on my channel for this, but now that I look back at it, it is an okay mnemonic. Okay, the tellular M is all munchies. Okay, tellular Riley munches. Tellular Riley was Elon Musk's girlfriend once upon a time. I mean, maybe she still is. So tellular Riley munches on M&Ms temporarily. Okay, so tellular Riley. Okay, so temporalis M&Ms. Okay, that is your masseter and medial pterygoid. Okay, T is temporalis, and M munches. Okay, because munching closes the jaws. Okay, munching closes the jaws. Okay, T, that's why I took tellular Riley, tellula. Okay, so temporalis, tellula. Okay, all except masseter. This is also important. Side to side movement. Who causes? All except masseter do the side to side movement of the jaw. Or all except masseter do the side to side movement of the jaw. Next is spinal nerves. Spinal nerves, this is okay. The only thing is, this part is important. 31 pairs, that is fine. 8 all this. C8 nerve exits below the C7 and above the T1. Okay, so C8 is the only exception. It exits below the C7 and above the T1. All other nerves exit below. Okay, all other nerves exit below. L2 exits below the second lumbar vertebra, like that. Okay, and basically what they are saying is, see, cervical nerve, they exit above the corresponding vertebrae. Okay, that if you have C1, okay, so C1 nerve will exit above the corresponding vertebrae, but C8, what it does, it exits below the corresponding vertebrae. Okay, C8, it will exit below, it is an extra, it will exit below. Okay, and above the T1, so that's why all the other nerves, they'll exit below. Okay, next we have, this was in MER 8. Okay, so this entire, how the spinal needle passes, that is important. So adult, your, obviously the, okay, so these are just this thing, this you can forget it, actually done a revision of it. Okay, this is something that is very okay. So okay, so in adults, okay, we have L1, L2, lower border of L1, L2. That is where the spinal cord is ending. Okay, so lower adults, L1, L2, adults, L1, L2. Everyone is lower border. Okay, so lower border is common. Alright, but this is very important, L1, L2. Whose adult may it is L1, L2. Okay, next is subarachnoid space extends to lower border of S2. So S2, here subarachnoid space. Okay, it is extending to the lower border of S2. So L2, just forget L1, remember L2. L2 is spinal cord, adult, all this is about adult. So L2 is adult, lower border of the spinal cord. L2 in adults, lower border of the spinal cord. S2 in adults, lower border of the subarachnoid. S for subarachnoid, S for subarachnoid, that's why S2. S for subarachnoid, that's why S2. Okay, and lower border to hai hi, that is lower border, it is going to be lower border for both. Okay, so done. S for subarachnoid, S2. Okay, so obviously when S2 is coming to the subarachnoid, so you can understand L2, just do S2, L2. L2 is spinal cord. Okay, L2 is spinal cord. Next is lumbar puncture, where it is produced L1, L2 when it is the ending, spinal cord ending. Then L3, L4 is adults, and L4, L5 is children.
Okay, L4, L5 is children. L4, L5 is children. Level of chorda equina. Okay, L5, S1 is infants. Okay, so let's go up again. L3, L4 adults. L L5, L4. Okay, L3, L4. See, as the age increases, the spinal cord level, I mean the height increases and the spinal cord level slowly goes up. Okay, so first we had L3, L4 is adults, now descending order. L4, L5 is children, and finally L5, S1 is infants. Okay, so it is going, means as we grow, the spinal cord goes up, kind of, because infants may even the sacral part, till the sacral part it is there, L5, S1, and here L4, L5 children, and L3, L4 adults. Okay, next is obviously keep the spinal needle between L3, L5, fine. Okay, next we have, let's try and do a little bit of active recall here. Okay, okay, which structure was what? Okay, so skin, superficial membrane, this is the anterior, no, this is the posterior longitudinal ligament. Okay, and this one is what? This one I forgot. This one is the ligamentum flavum. Then we have the epidural space, dura mater, arachnoid mater, conus medullaris. Okay, so let's see again. Uh, okay, sorry, I mixed it up. Did I? I think I did. Okay, supraspinous. Oh, not the posterior. Posterior longitudinal ligament is, that's it. Sorry. Let's see. Skin. Okay, so skin. This is skin, facial fat, fascia and fat, obviously. 3, 4, 5, 6 is important. 3 is supraspinous, interspinous, ligamentum flavum, epidural space. Okay, epidural space, dura mater, subarachnoid was fine. Okay, but 3, 4, 5, 6 supra, inter, ligamentum flavum, supra, inter and ligamentum flavum. That means even in this is the part that is most this thing. So supra, inter, ligamentum flavum, let's see. 3 is going to be supra, this is supra, this is inter, between, okay, between the this thing, and this is ligamentum flavum. Okay, supraspinous, interspinous, ligamentum flavum. Supraspinous, interspinous, ligamentum flavum. And finally we have phylum terminal. Alright, and posterior longitudinal ligament is here. Okay, this also, let's see. Ligaments, those were interspinous, means more related to the spine. Anterior longitudinal ligaments, anterior and posterior longitudinal ligaments is around the vertebral body. Okay, so anterior longitudinal ligament and posterior longitudinal ligament, anterior, posterior. Okay, and this is obviously the epidural space, dura, arachnoid, subarachnoid, and this. Okay, lumbar puncture needle is going right down, so this is done. Next, okay, so lumbar puncture ka here only we can finish it. Oh, okay, wait a second, just a second. Okay, so this is one of the MERS. Okay, this wasn't one of the MERS. Okay, okay, so let's see. First, we have, what do we have? I mean, okay, without seeing indications of lumbar puncture, what all did we have? We had, I forgot the mnemonic. Okay, there was papillary edema. No, P fails was the mnemonic. L was space occupying lesion, P was papillary edema, F was focal lesion, A was what? AILS. Okay, now it's time to see. Let's see. Okay, so focal neurological deficits, altered mental status, eye is immunocompromised always, infection at the local site, SOL. Okay, lesion, seizure. Okay, immunocompromised, altered mental status. Okay, so why? Because it prevents cooling. So here we do imaging before lumbar puncture. So ma'am always gives that question of HIV. Okay, so whenever she gives that question of HIV, it is going to be this thing. You always choose imaging before lumbar puncture. Always choose imaging before lumbar puncture. Contraindications of lumbar puncture also decrease platelet count, PT-INR, and local infection. Okay. Next, headache, vomiting, and fever. You can have stiff neck, photophobia, meningitis, altered mental status. See, meningitis mein there'll always be stiff neck and photophobia. In case of altered, okay, I'll just come back from Aarti, and then after that I'll